Hello again. Today, we're exploring Medicare Supplement insurance, also known as Medigap, and how these plans work to protect your savings in 2026. Medigap plans are private insurance policies designed to fill the gaps in original Medicare, covering costs like deductibles, copays, and coinsurance that you'd otherwise pay out of pocket. There are 10 standardized plans, labeled by letters A through N. Each letter offers a different level of coverage, but the benefits for each letter are the same regardless of which insurance company you choose. Recent laws, specifically the MACRA Act of 2015, changed the landscape. Since January 1st, 2020, new enrollees can no longer purchase plans that cover the Part B deductible, like Plans C or F. If you were eligible for Medicare before 2020, you're grandfathered in and can still keep or buy Plans C and F. For everyone else, Plan G has become the new gold standard. Plan G is the most popular choice today. It covers almost everything except for that annual Part B deductible, providing very predictable healthcare costs. Plan N is another excellent value. It offers lower monthly rates in exchange for small copays, up to $20 for some doctor visits, and $50 for emergency room visits. To be eligible for any Medigap plan, you must already be enrolled in both Medicare Part A and Part B. You generally cannot have a Medigap plan and a Medicare Advantage plan at the same time. The best time to enroll is during your one-time Medigap open enrollment period. This is a 6-month window starting the month you're 65 and have Part B. During this time, companies cannot deny you coverage for health reasons. If you wait until after this window, you may be subject to medical underwriting. This means insurance companies can look at your health history and potentially charge more, or even deny your application. Let's look at an example. If you're hospitalized for surgery in 2026, original Medicare charges a $1,736 deductible. With Plan G, your supplement pays that entire amount. Your out-of-pocket cost? $0. For doctor visits, once your annual Part B deductible is met, Medicare pays 80% of the bill. Your Medigap plan picks up the remaining 20%, leaving you with $0 out-of-pocket to pay at the office. It's important to remember what Medigap doesn't cover. You will still need a separate Part D plan for prescription drugs, and these plans generally do not cover routine dental, vision, hearing aids, or long-term nursing care. Choosing the right letter plan depends on your health needs and your budget. I'm here to help you compare the options and find the perfect fit. Reach out to Sunrise Benefit Advisors today.